Hello everyone and a very good morning. As you might know, the 28th of this month is World Hepatitis Day. While the world reels under the COVID pandemic, it is important to not neglect the brutal impact of other diseases, especially the communicable ones.
Before we proceed further, it is vital to have a brief idea about hepatitis in general.
According to the WHO, there are 5 main strains of the hepatitis virus, referred to as types A, B, C, D and E, differing in modes of transmission, severity of the illness, geographical distribution and prevention methods. In particular, types B and C lead to chronic disease in hundreds of millions of people and together are the most common cause of liver cirrhosis, liver cancer and viral hepatitis-related deaths. Ever since its discovery, it became clear that hepatitis C was the major cause of acute hepatitis after a blood transfusion that was neither related to hepatitis A nor to hepatitis B. It is now widely recognized as one of the common etiological agents for cirrhosis of the liver and is the leading cause of liver transplantation. Unlike hepatitis A and B, there is no vaccine available for hepatitis C. This leaves large swathes of populations, especially those in the lower strata of society, vulnerable to infections. To make matters worse, the antiviral drugs now available cannot be afforded by most people. Moreover, by the time antiviral drugs are administered, liver damage has already set in, considering the fact that hepatitis C caused by HCV can smolder within for decades to come without producing any obvious symptoms. As far as the natural history of hepatitis C is concerned, most of the cases of acute hepatitis C are asymptomatic. The only acute life-threatening illness caused by hepatitis C is a variant called fibrosing cholestatic hepatitis, which is seen in liver transplant recipients. The worrying aspect of acute hepatitis C infection is that spontaneous viral clearance is unusual, with nearly 54% to 86% of the infected individuals progressing to chronic hepatitis. Patients eventually end up with portal hypertension leading to ascites, variceal hemorrhage, hepatic encephalopathy, spontaneous bacterial peritonitis and hepatorenal syndrome. Extrahepatic manifestations include porphyria cutanea tarda, membranoproliferative glomerulonephritis, Sjogren's syndrome, Raynaud's syndrome, idiopathic thrombocytopenic purpura and non-Hodgkin's lymphoma. All things said and done, it is extremely vital to prevent the spread of HCV. Firstly, we must understand the modes of spread. HCV can be spread via blood transfusions, renal transplants, dialysis and IV drug use. Blood transfusion is an effective mode of transmission of hepatitis C infection as it allows a large quantum of infective virions into the susceptible patient. The long-term effects of blood transfusion is more evident in patients with hemoglobinopathies and those with clotting disorders who are usually multiply transfused and as a result are at higher risk for acquisition of hepatitis C. This includes thalassemia and hemophiliacs. The studies from all over India suggests that despite testing of blood units, hepatitis C infection is still a significant problem for these patients. Transmission of hepatitis C is known to occur with intravenous and percutaneous drug usage. This is a significant problem in northeast India and definitely in the rest of the country as well. In the only study looking at this aspect, the prevalence of HCV was an alarming 92% among 77 IV drug abusers from Manipur. There is a need to clamp down on the rampant abuse of drugs. This can be carried out by awareness campaigns, a strict crackdown on drug trafficking and perhaps even restrict their entry into the country. The medicinal use of drugs must also be stringently monitored and regulated. There is a need to improve the current programs, to have a coordinated effort between ministries, ensuring uniformity at the policy level, to make scientifically informed choices and to strengthen the supply reduction chains. Patients on hemodialysis are at an increased risk for acquiring hepatitis C infection as a result of cross-contamination from the dialysis circuits. In addition, these patients are often anemic and require multiple blood transfusions. This raises their infection chances once we factor in blood transfusion as well. Considering everything which has been said and discussed, it is vital to acknowledge hepatitis C as an emerging disease. On this World Hepatitis Day, when we decide that hepatitis can't wait, we must pull up our socks and look at latent threats as well. We cannot neglect hepatitis in the wake of the COVID pandemic, or we'll end up paying a hefty price in the future.